Neurovascular assessment, 6 Ps. Neurovascular assessment is a focused clinical examination to evaluate the function of blood vessels and nerves in a limb. It is used primarily after injury, fracture, surgery, or cast application. Purpose: to assess adequacy of circulation, motor, and sensory function in a limb. To identify early signs of compartment syndrome, nerve damage, or vascular compromise. To help prevent permanent tissue damage, loss of limb, or disability. When to perform: after orthopedic or vascular surgery. Following fractures, dislocations, or crush injuries. Before and after applying casts or tight dressings. During monitoring of a limb with suspected circulatory or nerve compromise. In trauma patients, especially with long bone or joint injuries. Components of neurovascular assessment, the 6 Ps. Component: what to assess. Pain. Pain intensity and location, especially pain on the passive movement of the limb. Pallor. Skin color, pale, cyanotic, or dusky appearance may indicate poor perfusion. Paresthesia. Presence of tingling, numbness, or altered sensation, sign of nerve involvement. Paralysis. Movement limitation or inability to move limb/fingers/toes, motor nerve damage. Pulselessness. Absence of distal pulse, e.g., dorsalis pedis, posterior tibial. Use Doppler if needed. Poikilothermia. The limb is cold or cool to touch compared to the unaffected side, reduced perfusion. How to perform. 1. Compare both limbs, affected versus unaffected. 2. Assess capillary refill, should be less than 2 seconds. 3. Palpate pulses, radial, posterior tibial, dorsalis pedis. 4. Ask the patient to move his or her toes, motor. 5. Ask about or check for numbness/tingling, sensory. 6. Feel for skin temperature and observe color. Red flags: suspect compartment syndrome if severe pain is not relieved by opioids. Pain on passive movement. Tense, swollen limb. Paresthesia or numbness. Pulseless limb or faint pulse. Pallor or cold extremity. This is a surgical emergency. Notify the physician immediately. Delay can lead to permanent damage. Management of neurovascular compromise. Action purpose. Notify the physician immediately. Early intervention is critical for compartment syndrome or ischemia. Loosen restrictive dressings/casts relieves external compression and restores blood flow. Elevate the limb to heart level promotes venous return without compromising arterial supply. Monitor neurovascular status frequently every 15 to 30 minutes if abnormal findings are present. Administer pain relief as ordered. To manage severe pain, which could be a warning sign. Reassess after every intervention. Ensure effectiveness of action taken and detect changes early. Prepare for possible fasciotomy. Surgical decompression is required if compartment syndrome develops. Summary: mnemonic: 6 Ps save limbs. Pain. Pallor. Paresthesia. Paralysis. Pulselessness. Poikilothermia.